The first meeting of the MNsure Oversight Committee will come to order. We do have two members participating by phone today for medical reasons. And so if we could just kind of take a quick vote to say that that's okay for today, that would be great.
Aye.
All in favor? All right. Opposed? All right. And we'll do that. So my only job here is to elect the committee co-chairs. So are there any nominations? Representative Hayden, or Senator Hayden.
Well, thank you, Mr. Speaker. Mr. Speaker, I'd like to nominate Senator Laurie as one of the co-chairs.
Okay.
And I would nominate Joe Atkins.
All right. Senator Laurie and Representative Atkins have been nominated. Any other nominations? All right. Seeing none, all in favor of Senator Laurie and Representative Atkins co-chairing the MNsure Oversight Committee, say aye.
Aye.
All opposed, no. That motion prevails. Senator Laurie.
Thank you, Representative Thiessen. The two members, by the way, that are on the speakerphone, I believe, are Representative Atkins and Representative Mack. Is that correct?
Yes.
Yeah, okay. And so, I think that without objection, the manner in which we will be co-chairs is kind of how we do in conference committee. It's also how we did it with the Healthcare Access Commission back in the day. We'll just trade the gavel between meetings, so every other meeting each of us would have the gavel. Just to orient members to the materials that are available, in the packet with the pink dividers, you'll find all of the rules and regulations. These are the ones that have been adopted. The official policies and procedures is the second piece of it, and the pink tabs tell you where you're at in the sheet. So the policies and procedures that have already been adopted by the MNsure Board of Directors are the next set. The third set is the draft policies and procedures for members' reference. This is all available publicly, too, on the website. And then other MNsure materials is the final section of the packet that was put together for members. The requirements of official transfer of authority, upcoming board decisions, and then the statute itself that we passed in the last legislative session. Not that we haven't spent plenty of time reading that already, but anyway, with that, we have a fairly full agenda, and so we'll jump right in. I'd like to
Senator Laurie, may I ask a quick question before we move forward? As you know, it's taken us a little while to get this first meeting organized, and I'm also serving on another legislative oversight committee that also is not meeting. At least I think we ought to be clear about what our commitment is in terms of having regular meetings. Oversight committees can't do their oversight work if they don't meet. And so I'm wondering if there's some place on this agenda where we'll be having that conversation. To not meet and to not do the job that we've been asked to do, I think, would be irresponsible. So I wonder if you could speak to that.
Senator Sharon, item 6 is discussion of future agenda items, and with that, the intention was to poll members about how frequently they'd like to get together, how we'd like to operate as a. And it was my intention to make that a collaborative decision. So we haven't decided on a series of meetings, but we'd put it to the commission to determine how we fulfill our role.
Okay, great. And may I just follow up with another question? When we were talking just a few moments ago about the exchange of the chair between you and Representative Atkins, then the call of the meeting would be in the hands of that chair, similar to what we do in our conference committees.
Right.
But what happens there is that the person can simply not call the meeting if they don't want to. So that's the issue that I want to talk about when the time comes, that we have a commitment and an obligation that's not, controlled by one person who happens to be holding the chair at the time.
Okay. We'll
have that conversation.
And kind of in the same vein of trying to figure out how it is we're going to approach this, I thought that we'd get an overview of our committee's authority from Senate Counsel. Ms. Kavanaugh?
Chair and members, Legislative Oversight Committee is in 62V, the chapter. I think you've got a copy of that in this packet, and it's specifically 62V.11. Generally speaking, the Legislative Oversight Committee is established to provide legislative oversight over the implementation of Chapter 62V and the operation of MNsure, and to recommend any changes to the legislature and to the MNsure board in terms of policy implementation and the statutes that are involved in 62V and MNsure operation. The only statutory requirement is that the committee meets at least annually. The MNsure board is required to provide and to present certain information to the Oversight Committee. It is required to present its annual report that is required under the statute. It is required to present the appeals process that it is required to establish in statute. And it's also required to present any action that the board takes regarding the treatment of multi-employer plans. The board is also required to submit to the committee the proposed rules that it adopts through the accelerated process that was put in statute that's available to the board until January 1st, 2015. These rules must be submitted at the same time that the proposed rules are published in the state register. The committee then would have 10 days upon receipt of the rules to review the rules, and if a majority of the members that were appointed by the House and a majority of the members appointed by the Senate wanted to request further review of the proposed rules, that's what can happen then if there's a majority on both the House and the Senate. Then, depending on whether the legislature is in session or out of session, the effective date of the rules would then change. And it would give then the committee time to review the rule and to propose any changes legislatively. Also, the board is required to submit for review its annual budget for the next fiscal year, and it must submit to the committee that budget by March 15th of each year, beginning March 15th, 2014.
All right.
That's it.
So that's our charge. And then also, in the statute, as far as legislative oversight of the MNsure and its board, I think it's important to note that although the board was appointed during the last legislature, we did not get around to, but we are required as a legislature to confirm the board members, but not this oversight committee, but the entire legislature. And it's both the Senate and the House. I believe the manner in which it's structured is that it would require that both the Senate and the House vote to reject a board member in order for that board member to not be able to continue as a board member. And so barring that, they would serve the pleasure of the governor.
Right, until they're not, yeah.
Right. So that's this committee and the legislature's statutory framework. With that, we'll move on to the presentation by Brian Beutner, the chair of the Board of MNsure. Welcome to the committee. State your name for the record.
Hi, I'm Brian Beutner. I am chair of the board of MNsure, and I'm not sure it's a presentation so much as some remarks, so we'll try and keep it informal. Thank you very much for inviting me to this group, and certainly for providing the support to get MNsure established. Without you, we wouldn't be here. It is something interesting to point out. It's a sort of unique beast that we have that is federally grant supported through 2014, after which point we as an organization should be self-sustaining. So I'll just talk a little bit about what we are doing as a board today and what we'd be doing in the future, and then a little bit about how we're working together. I won't go into the details of the day-to-day activities. There's a nice presentation from April and her staff. They're literally working around the clock to get up and running. But from a current board perspective, we do not yet actually have authority as you guys are all well aware within the statute, we need to establish the infrastructure, the governance structure, so that the legislature can certainly feel confident that we have the procedures and policies in place to oversee this. So, my background, as far as working with startups and getting new organizations off the ground, this is something we've done all the time, is creating those governance constructs. It's a little bit more hairy, quite frankly, than a typical startup in the sense that it's a big operating business once it's up and running. We need more functioning, more robust governance policies. And because of the nature of our organization, we're doing it through open meeting laws in public so that we get insight and input from others as well. This is not just an internal policy. So basically what we've been doing since we were brought together late spring, early summer, is we've been having meetings every other week all summer long, and really they're geared to getting this up and running so that we will have the ability to accept the transfer of authority when it's appropriate, that we have everything in place. And so our meetings are running 4 to 5 hours, and we spend about half of it on governance constructs, of literally walking through the different types of things that we need to have in place, whether it's charter, whether it's the advisory committees, whether it's internal policies and procedures, and doing that in sort of a structured manner so that people can provide us input to make sure that we're putting in the right governance for our organization. The other half of the meeting is really devoted to understand the operations of MNsure. Through federal grants, we have, as a state, been building the structure of MNsure for the last 2.5 years, and so there's a lot of work that has been done already, not just from the MNsure staff, but from other agencies within the government, Commerce and Health and Human Services, to name a couple. And so we as a board need to be fully cognizant and up to speed on the operations of the organization before we can assume responsibility for the policy, the oversight, and the operations. And so that's really what we've geared this summer towards. We're heading towards, call it Labor Day, at which point we should be able to accept the transfer of authority and be off and running. At that point, the nature of what we do as a board switches a little bit, and we spend a lot more time, obviously, on the budget, on operations, on metrics to make sure we're achieving our goals, and obviously focused very heavily on things like October 1st, where we're up and running and can start interacting with the public. When you start talking about the policy decisions that we as a board are going to be responsible for in setting direction, the good part for me as a new board member, and others on the board as well who are still getting up to speed, is a lot of the policy decisions don't become impactful until 2015. A lot of what's happening in 2014 has been already set in stone, and so a lot of that groundwork for the policy decisions really won't begin until, call it, the spring of 2014, as we as a board start doing the work at our meetings, bless you, to start understanding what should we be doing and how we can best affect the statute. Just to give you a little sense of how we operate as a board, it's a unique board. We're a relatively small board. There's just 7 of us. We have, a tremendous diversity of experience, from large companies to small companies, from startups, from in IT, in healthcare, in policy, all of the things that I think we need to be able to adequately fulfill our mission. And, we've spent most of the summer learning about MNsure, learning about setting up our governance operations, and starting to dig in to the operations a little bit by bit. What we're finding is what really works well for us as a small board is for one person to take on all of it is almost overwhelming. And so we divide and conquer to a certain extent. We had a discussion with the staff on call centers, for example, last week, and we had a couple of members of the board there just to dig in and get more comfortable. We'll be doing the same things with other topical areas so that we as a board can feel comfortable that we've provided the appropriate oversight. And just sort of one sort of final summary comment about the board and the way we operate. Although we each of us serve as a specific statutory seat, I know when you established our board, the membership was really prescriptive. We needed to have somebody who understood small business interests. We need to have somebody who understood people with disabilities and needs. We needed to have people who understood health policy. And while each of us individually fulfill one of those statutory seats, I think we view us not as representational, but as a board that serves the entire constituency. We all serve the state, and most importantly, we all serve the mission. The purpose of the organization is to ensure that every Minnesota resident and small business, regardless of health status, can easily find, choose, and purchase health insurance product that they value and does not consume a disproportionate share of their income. And that's really what guides us as we operate on a daily basis, is how can we make sure we're fulfilling that statutory mission in the role we serve for both the legislature and the populace as a whole. So I'll just sort of stop my remarks there. If you have any questions for me, great. April can come up and can talk in much more detail about the activity of MNsure. But once again, I appreciate you for inviting us and inviting me in particular. Thank you.
Mr. Beutner, thank you for coming and giving your perspective. Any questions of members? Well, thank you for that.
Thank you.
With that, we'll move on to the update from April Todd-Malmlov on how things are going.
You can give us a couple of minutes. We're trying to get the slides up here on the screen.
Okay. Are you going to start with that video again?
Not the video again, no.
Oh, good.
Seems like we're good to go. Mr. Chair, members of the committee, what I wanted to do with the update today is there are a few topics that you had asked for updates on, and those topics included our grant status and what we've spent to date, what is still left to be spent. Talk a bit about customer service, and that includes assisters, so the rule that we had put out in April and finalized at the end of April. Information about our call center related to customer service, and information related to outreach. You had also asked for an update on the IT and the business application, how the IT work is going. And then finally, one of the things that was highlighted by Ms. Kavanaugh is that whenever we have a new rule that is going out that is presented to this committee, we actually have a proposed rule that went out this morning about appeals, and so we have information about that as well. Staff has received a copy of that. I think they'll be getting a copy to you during the meeting about appeals, and so we can walk through that as well. So first off, grant status and spending.
Ms. Todd-Malmlov, on our agenda, too, there's an update on plan submission and approval with the Department of Commerce. I know that's not your total bailiwick, but there has been a lot of questions about that. So as you go through, are there some slides on that in here, or will we just handle that with questions afterwards?
Mr. Chair, the Department of Commerce is here, and they will be
Right.
covering that after this presentation.
Okay, so that's what we'll do. Good enough.
So as the committee is aware, there are multiple financing mechanisms that will fund MNsure over time. And just want to do a quick review of that prior to going through kind of our grant status and the funding that we have spent. So first, as you're aware, so we are operating under a federal exchange grant, or actually multiple federal exchange grants. We have gotten them annually. And we will be funded through those grants through 2014 for development and operations, except for the Navigator program. So we cannot use federal grant funds for the Navigator program. Just as a reminder for that, which in the statute that was passed, the Navigator program will essentially be the MNCA program, the Minnesota Community Application Agent program, for the first year, since it already has state statutory funding. The second mechanism that we have for funding MNsure is through a DHS cost allocation. And what this means is that during the development phase, for the development of IT, we are required under federal regulation to cost allocate to medical assistance the portion of the system that is being built that will assist them. And so that is also part of the funding that is there. As we had discussed previously, this is primarily comes in the form of a 90-10 administrative match, where 90% of that is funded by the federal government and has a 10% state match for a majority of that spending. There are some spending in there that is a 75-25, but the majority of it is a 90-10. The third is the premium withhold that was included in the 62V legislation. And in 2014, in addition to grant funds that will fund us for operations, there's also the ability to establish up to a 1.5% of premium withhold. And in 2015 and into the future, that can go up to 3.5%. These two decisions would be made by our board once they are transitioned to full authority September and later. And so those are a few agenda items that will be on our board's agenda starting in September. And then lastly, just another category is also included in the legislation is the ability for us to seek and accept money, grants, and loans. And specifically on the loan side, what was included in the legislation is the ability to get up to a $20 million loan from MMB during the first biennium to be able to address any enrollment variations different from what we have anticipated, and to also potentially deal with some cash flow issues that we may have in 2015 when we transition from grant funding to the premium withhold.
Mr. Chair, sorry.
Representative Hoppe.
Thank you, Mr. Chair. If we have questions you want us to ask now, hold them to the end.
Do you have a preference? I think it works better to just ask as we go, as long as we don't get too bogged down.
That's fine, Mr. Chair.
Thank you, Mr. Chair.
Representative
And Ms. Malmlov, or Todd-Malmlov, you just mentioned talking about the premiums, and there's going to be the up to 3.5% on the premiums. Do you know how many enrollees you're expecting? What happens if there aren't enough? What if that doesn't cover, not during the first year, but what if things are, for whatever reason, there's a drop in the number of people that are enrolled in 4 or 5 years from now? How do things get paid for if there isn't enough money coming in just from the premiums?
Ms. Malmlov.
Mr. Chair, Representative Hoppe, what we have projected a variety of different scenarios that we could have for enrollment. If you remember from the session, we had projected a low, medium, and high enrollment scenario. Even on the low scenario, we have also have a very low scenario that we have also projected, which is half of that enrollment. Even down to that level, the 3.5% of premiums up to that would cover that level, and so we have projected that out. If there happens to be if it's much lower than that, that would be something we would have to address with the legislature.
Thank you.
So just wanted to briefly go through the plan for financing for 2013, 2014, 2015, 2016. So in 2013, we will be operating primarily under the Federal Exchange Grant, DHS cost allocation. There is the ability to get a short-term loan starting July 1st of 2013. We have not yet sought out that loan and are not sure whether we would need that in 2013. In 2014, we will be able to operate under another federal exchange grant. $40 million was approved by the legislature, plus an amount for risk adjustment and evaluation to the Department of Health. We will be submitting this grant application on August 15th, and it will be roughly around that $40 million amount. Also included in that will be the DHS cost allocation. And again, as I mentioned, we will be working with our board into the fall as to what level the premium withhold will be set at for 2014.
Mr. Chair? Mr. Chair?
Senator Benson.
Thank you. And Mr. Chair and Ms. Malmlov, so what's the total spend you anticipate for 2014, including the loan you anticipate needing?
Ms. Malmlov.
Mr. Chair, Senator Benson, we are not yet sure if we will need the loan. What we have incorporated into our spending for 2014, it's in the mid $50 million mark for 2014. About $40 million of that will come from grants. The rest of that will be cost allocated to DHS.
And thank you, Mr. Chair and Ms. Malmlov. Do you know what the interest rate for the MMB loan would be? Has that been part of the discussion, or did they just have a standard internal rate of return that the exchange would be charged?
Mr. Chair, Senator Benson, we have not yet had those conversations as we don't yet see a need to have that loan. Into 2015, that will be the first year that we would be operating under the up to 3.5% withhold. So we will, again, as I mentioned, this fall and into the spring, be working with the board to establish that level. We still anticipate that that will be around the 2.25 to 2.5 mark. That's where we're still projecting that. And that will also include a DHS cost allocation. That cost allocation will include IT and other functionality as well that benefits DHS. And then 2016 and into the future, that will include the same financing mechanisms, but we do lose the ability to have that loan from MMB going into 2016.
Ms. Malmlov, so your projection still for 15 is 2.25 to 2.5 withhold is what would be needed, and that's under which enrollment scenario?
That's under the high enrollment scenario. If we do get down to low, that would have to get closer to the 3.5. But given the projections that we think we're still in that range.
Okay.
Mr. Chair?
Representative Hoppe.
Thank you, Mr. Chair. Following up on that, could you give us what those numbers are? I've got it in my office, but off the top of my head, I don't remember what the high number and the low number were.
For enrollment. Mr. Chair and Representative Hoppe, so those numbers have changed a bit with the resulting passage of the BHP legislation. I don't have the numbers handy on me, but we can follow up with the committee and make sure you have the updated numbers that include the Minnesota Care enrollment.
Right, because members will recall we had a expedited schedule for passage of this, and so the numbers that we were using when we passed this were we didn't know whether we would have the new Minnesota Care funded by the BHP or not, and it has an effect on the enrollment. So I mean there are updated numbers to take a look at from the time when we passed the MNsure legislation.
So next, related to the specific request that the committee had related to the funding and the spending that we've received. So for federal exchange grants, we have received multiple grants that total $110 million. Through June, we have spent $41 million of that. We have encumbered in contracts $13 million of that, and there is a remaining $56 million of those grant funds that we have received. We also have committed $55 million from a Medicaid cost allocation. Spent through June of 2013, we've spent $29 million of that. Encumbered in contracts through June of 2013 is $14 million. There is a remaining commitment of around $12 million under those two funding sources. And the next few slides talk about where that money has been spent, and this is a combination of the two sources. So this brings together the grant funds and the DHS cost allocation together. So the total of that has been spent, and those that are committed through what we told the federal government that the grants would be for and that the Medicaid spending would be for in total is $165 million. So joint funds spent through June of 2013 is $70 million. On MNsure personnel, we have spent $2.7 million. On administrative expenses is $2.2 million, and that can be broken up into three general categories. The first is rent, furniture, phone, and equipment is about $1.1 million. Agency, indirect, to cover indirect costs, services that we use from other agencies, administrative services, around $600,000, and other supplies, including supplies, printing, and travel, is about $500,000. On the IT side, that's where the bulk of the spending has been. It's been $61.4 million spending in IT. That includes hardware and software infrastructure and associated consultants. It's at $32.9 million has been spent. On the actual IT application, this is our contract with Maximus. That includes the subcontractors of IBM Currem, Connecture, and EngagePoint. Of that contract, we have spent $25.1 million. As you may be aware, the total of that contract is about $46 million. We spent slightly over half of that amount in that contract. And then we also have annual maintenance on that application, which is roughly comes to around roughly 20% or so of the value of the licenses that are purchased through that, and that will be an annual expense of about $3.4 million that we pay every October.
Mr. Chair?
Senator Benson.
Thank you, Mr. Chair and Ms. Malmlov. So the $46 million total contract, as of the end of June, you had spent just over half. And this project is due to be completed October 1st.
Mr. Chair, Senator Benson, that is correct.
And so, Mr. Chair and Ms. Malmlov, I'm wondering, are you going to spend all that money? Is there going to be a huge spike in spending that we're going to see coming? Are we not at steady state, and now we're paying consultants to meet a deadline that we're at risk of not meeting? I'm wondering why we've spent half and we have very little time to go.
Ms. Malmlov.
Mr. Chair and Senator Benson, the structure of the contract actually withholds a significant amount of money in that contract until there is successful completion of those deliverables. And so we anticipate that the bulk of the majority of the spending will come around October 1st and later, once the functionality is actually up. We found that it was very important to ensure that the functionality got up on time, that we did withhold a significant amount of that money to provide incentive for those deliverables to be completed on time.
Very good. Thank you.
So on the last category is on operations. We have spent $3.9 million, and that can be split into two categories at the moment, which is operations design contracts, so helping build out our business our business processes outside of the IT, and that has been $2.9 million, and we have spent around $1 million on outreach and marketing. So in terms of the commitments, there are about $95 million that has yet to be spent, but it is committed into certain categories of our grant and in our advanced planning documents that are sent to CMS for Medicaid. And so what is included in that is $5.6 million additional for MNsure personnel, $3.9 million for IT personnel, regulatory agency personnel of about $2.8 million, administrative spending at $6.8 million, rent, furniture, phone, and equipment of around $800,000, agency indirect of $5.8 million, and other, including supplies, printing, and travel of around $200,000. Now, on the IT side, we are expecting to spend another close to $52 million. That includes $27.7 million on hardware and software infrastructure and consultants. And the IT application contract, again, this is the Maximus contract, so there's $20.8 million left in that contract. And the application annual maintenance of $3.4 million upcoming in this October.
And
Senator Benson.
thank you, Mr. Chair and Ms. Malmlov. Seeing a lot of personnel here, could you tell us how many people are currently employed by MNsure and kind of what your peak employment looks like given these commitments?
Mr. Chair and Senator Benson, we are roughly at around 40 staff. It changes daily, so that may be a little off. I can get the actual number for you. We will be upwards of 85 to 90 staff. That includes staff for our call center that we will be operating here in Minnesota. It does not include staff for Minute, which is an additional roughly 30 staff that are there for that. One of the things that I will mention around the dollar amounts that are here is that we have not been able to bring on staff as quickly as we would have liked and what was applied for in our early grants. So we do have some salary savings that are here that we are working with the federal government to rebudget those into other categories. We have not yet gotten approval to rebudget those quite yet, but this funding would go into some other categories. And part of the reason for the delay was getting into a new space that could house that additional staff. On the operations side, this last bucket, we have $23.8 million left to spend on operations, and that goes into a variety of different categories. Operations design and development contracts of about $4.9 million. Again, this is around our business operations, so some of the manual work behind the IT. Outreach and marketing of $7.6 million. In-person assisters, this is related to the grant funds, and we'll talk about that a bit later. It's related to the rule that we put out around in-person assisters, navigators, agents, and brokers. There's $4 million in there for grants, infrastructure grants for those organizations to help establish them, get them ready to go to be in-person assisters. Those grant funds will be awarded by the end of August. For the call center and customer service, this is operations. Again, operations starting in September through the end of this calendar year. About $5 million. Premium processing of $800,000. Appeals we anticipate $700,000, and other miscellaneous contracts of around $800,000 in those commitments.
And Mr. Chair.
Senator Benson.
Thank you, Mr. Chair, Ms. Malmlov. So outreach and marketing are going to be contracts put out for bid to public relations firms, or have those already been bid out? And I guess I'm trying to outreach and marketing, the in-person assisters you said will cover in depth, a little more deeply, and then the call center customer service, we're looking at $5 million for September through December. Is that just for chairs and desks and phone support? You said it's not personnel, so if you could deal with outreach and marketing, call center in just a little more depth.
Yes. So, Mr. Chair and Senator Benson, so on the, to your first question around outreach and marketing, so the outreach and marketing, we do have a contract with BBDO. That is the marketing advertising firm that we are working with. They are in the process right now of negotiating ad buys for TV and radio, bus, billboard, every mechanism for that. Those buys will come out of this dollar amount. This will also include, we will have regional liaisons that will be in 8 regions of the state. Their job is to distribute marketing materials that are also included in this budget as well. And so that will start to roll out in August. So much of this spending will be spent in August and into the later months through the end of the year on the outreach and marketing side. For the call center customer service, this includes within this category some IT and business process tools, CRM tools. The salaries for those staff do exist in this budget for right now on call center, because when we submitted this grant application, we weren't sure if we were going to be contracting out for a call center or bringing that in-house, and so it is included in this budget. We do need to request a rebudgeting to that to put that into staffing. And so those are the main categories that are included in the call center.
And that outreach and marketing piece, I mean, how long does, I mean, I know that we understand how important it is that we have Minnesotans understand what we're bringing up so that we have the enrollment to support this. But how long will we have to maintain that marketing and outreach level of commitment? That one will probably tail off after a period.
Yes. So, Mr. Chair, I would actually split them up into 2 buckets, outreach versus marketing. We do see a need for ongoing outreach and have a budget committed to, a sustainable budget committed to that for outreach and our in-person assisters for materials and making sure that there are boots on the ground to do that work. On the marketing side, we do see a very large need in this first year and into 2014, and that the need for marketing over time would decrease.
That looks like the end of the budget overview. Any further questions of members on the budget piece? All right.
Okay. So next, going into customer service. So I want to talk about assisters, a call center, and outreach kind of incorporated into all of that. So really, how we view customer services is a 3-pronged approach. So we definitely have the website, and we'll hear a bit more about that later in this presentation as well from Minute. Secondly is the toll-free call center. As you may have heard, our call center will be opening on September 3rd, so 1 month prior to open enrollment. We know that people have questions prior to that, and so it will be open a month early. And then the third really part of our customer service perspective is that one-on-one assistance. And the one-on-one assistants are our in-person assisters, navigators, and our agents and brokers that will be those boots on the ground providing help. And so first wanted to talk about the call center and how that is being structured. As we discussed during the legislative session, we were at the time looking through different models for how to operate the call center, and we're evaluating whether or not we would contract that out or we would operate that in-house. And so in evaluating what we would do with the call center, we really had a few goals that we kept in mind in doing that evaluation. The first was making sure that we had a streamlined customer service experience for everyone using MNsure. As you're all aware, MNsure will serve a very diverse set of populations, including small businesses, individuals, and public program enrollees. And so we wanted to make sure that we had a common front door for everyone. When they apply, they don't know what they're going to be eligible for. And so making it as simple as possible that they had one number to call to get the help that they needed. Second was cost-effectively leveraging existing resources and expertise. There's a significant level of resources that already exist in the state, both at DHS and at the counties as well, that currently provide customer service to our public program enrollees, and so wanted to make sure that we were effectively using that resource and was not creating an additional expense for MNsure, and so not trying to duplicate what was already existing in the state, but bring all of the resources together and make them work more effectively and cohesively together. Third, a priority for us was to upgrade and share the technology that we would be using. We are implementing some of the most advanced call center technology that we have to be able to do not only just talk to people over the phone, but through email and chat and video as well over time. And so wanted to make sure that our partners, as much as possible, were able to use and share that same technology. And so the Department of Human Services is also bringing that same technology online to enhance the customer service experience for everyone, and so that we're using the same mechanisms. The fourth, and really this was, from my perspective at least, the most important goal that we had, and looking at what kind of call center model that we would have, and that really is the ability to adapt quickly to changing needs. This is the first time that we will be doing this into open enrollment. A lot of people coming in the door at one time. We've been looking at a range of what the needs may be, from very low to very high. And we need to be able to adapt very quickly to what those needs may be of consumers coming into the call center. That was one of the reasons that we decided to have the call center operate locally under close local management and control, so that we did have the ability to adapt much more quickly than oftentimes you can do under a contract and out of outsourcing. And so we found that this was going to be very important for us to react quickly to customer needs and any problems or issues that may arise. And then lastly, as I just mentioned, kind of local control and management was very key to that. So I won't go over these in detail, but just wanted to kind of share some best practices of what we were looking at. So first call resolution, trying to get someone to a live person as soon as possible, answering their questions 90% of the time. And making sure that we have those very streamlined connections between DHS and MNsure and the counties. We've been also working very closely with our carriers because we do know that there are going to be questions that we get and they get, that vice versa, that do belong in other call centers. And so we're really working very closely with our partners to make sure that customers can get their questions answered as soon as possible. And we anticipate that the types of requests that we will get is general web application navigation assistance, password resets, application status and enrollment questions, some health plan related questions. We think we'll get questions about benefits and pharmacy coverage that we do need to refer over to the plans, life event changes, questions from assisters, including agents and brokers and our navigators, to help people get the help that they need, billing questions and appeals questions. So we do anticipate a broad range of questions that will come into the call center. And so how we have structured this is really as a virtual model. MNsure will be the front door of the call center, and it will have connections behind the scenes to DHS, to the counties, to the carriers, also as well to the senior linkage line. We know that open enrollment for Medicare is also at the same time, and so there may be some confusion as to which number to call, so we do anticipate we will need to forward those calls as well. And so again, I won't reiterate what is on here other than mention a few things, which are the call center hours. So our call center will operate Monday through Friday from 7 in the morning till 8 at night, and also with weekend hours during open enrollment and potentially other high volume times as well. The call center will have bilingual staff. We will also have other language translation services and oral interpretation services as well. It will also be accessible for the disabled. And as I mentioned, we will be going live on September 3rd. So next one is to talk a bit about the one-on-one assistance, and this is specifically related to the rule that we released on April 1st, was finalized on April 30th. So in terms of assistance, really there are 4 different buckets. There are navigators, in-person assisters, certified application counselors, and insurance producers, or more commonly known as agents and brokers. So our navigator program is a requirement. Under federal law, we are required to have a navigator program to operate a state-based exchange. Those navigators, really what they are they must provide impartial information about the plans that are available and what people may be eligible for. They provide outreach, and they provide assistance in facilitating individuals and small businesses enrollment into plans. And so for 2014, the Navigator program essentially is going to be the MNCA program, which is a Minnesota Community Application Agent program that has existed in Minnesota for quite some time. It already had state funding and is operated by the Department of Human Services. This is a 1-year operation of this program through the MNCA program, and over time it will transition into a MNsure funded program. Our in-person assister program is an option through the federal government. States can operate an in-person assister program. We can get federal funds to operate this program. In all practical terms, the Navigator program and the in-person assister program are almost identical in terms of what services that they provide. And as I mentioned previously, our Navigators and in-person assister program will transition into one common Navigator program into 2015. For 2014, the reason for 2 programs is primarily a funding issue, and that we can't use federal funds to fund the Navigator program. We are encouraging people to be both navigators and in-person assisters. So if there are existing organizations that serve as MNCAs, we are encouraging them to also serve as in-person assisters so they can get funding from both of those sources. The third group is a certified application counselor. This is another category of assister that is available under the federal law. How these organizations are different is that they are not funded by carriers, and they're not funded by MNsure either. They do not receive funding, but they have access to our system and are able to enroll individuals through that system. Some examples of who these organizations might include are healthcare providers, so hospitals. When individuals show up at the hospital, they're uninsured. They can help them get access to coverage at the hospital. HR departments. We have had communications with some larger organizations that don't provide health insurance to their part-time workers and would like to have access to the system to help their part-time workers get access to coverage. And so they can serve as certified application counselors as well. Including libraries can also serve in that role. So a variety of organizations can serve in that role and not be paid. And then lastly, the fourth category are insurance producers, and they operate very similarly to as they do today. They are paid by the carriers. They will be able to access our system as long as they pass the training that is available and the competency tests for using MNsure.
The certified application counselor will be trained and certified by MNsure, correct?
Correct. All 4 categories will receive very similar training, and all need to pass a competency test to be able to access the system. And so this slide.
Representative Hopp.
And maybe I missed this, but when you were talking about the MNCA program for 2014 not federally funded, is that already in the DHS budget, or is that already accounted for somewhere, or is that an additional new cost?
Mr. Chair and Representative Hoppe. So it does have an existing appropriation through the DHS budget.
Thank you.
For the roles and responsibilities, this is just a chart to kind of explain how these 4 different types of assisters are similar and different from each other. So all 4 entities can provide application assistance. This is eligibility application assistance for different programs. The navigator, in-person assister, and insurance producer can also do enrollment assistance. That is not included in the application counselor, assuming that enrollment assistance goes through from the individual on their own. For 3 of these categories, the navigator, in-person assister, and certified application counselor, they would provide impartial information. And for insurance producers, they are the only category able to provide recommendations and advice as to which plan would be best for their financial or medical condition. All 4 categories need to provide referrals to other organizations where that is where it's better for the individual to be served by a different entity. They will all receive training and have to pass the competency tests. And all 3, except the certified application counselor, will show up online in our directory. So if someone is going through the application on their own and they need help somewhere along the way, they'll be able to click on something that says, I need help, be able to search within their geographic area to find a place where they need help, and get connected to that organization. We will not be providing that for certified application counselors, as they are there kind of serving their own internal constituency and don't really, many of them have the capacity to bring on additional assistance work.
I mean, I'm thinking through a couple of things. Insurance producers provide information and advice. It doesn't have to be impartial, but there's rules regarding disclosure and making sure that consumers are informed about the fact that you may be receiving advice that is not and information that's not impartial. And then certified application counselors, the piece where they're not on the directory, the issue with libraries and stuff, I mean, I think that could be a very productive route for a lot of communities. And you're not going to see on the MNsure website that your library has the training and the resources to help you get through this? Is that...
Mr. Chair, it really depends on what category the library wants to be classified as. If they want to be an in-person assister, they can absolutely do that, and they can get paid for providing that service. If they don't want to provide that level of service, but just want to have it available there, they can do that as well. So it's really up to the organization coming in as to what level they want to serve at.
Senator Benson.
Thank you, Mr. Chair, Ms. Malmlov. I'm not sure where you would be most comfortable addressing this, but the people who are doing this assisting are going to have access to a lot of personal information. And I was looking through some of the training requirements that they understand privacy. And so I'm just getting to your rules section 770.0080, and it refers to CFR Title 45, Part 155.26, attest to its data security and privacy practices. How are we going to make sure that they comply with Minnesota data practices? Because ours are much tighter than the feds. And I would really like that to be the standard so that we maintain some level of control of this data. I see it mentions state data in here, but I would like to see that elevated, and I don't know if I need to make a board comment so that the rule can be changed. But if you could please address that.
So, Mr. Chair and Senator Benson, so the privacy and security rule that's there under statute, all of the Chapter 13 provisions and the additional language that was included in the 62V legislation does apply to MNsure. What the rule does is really cover things that weren't covered in statute, and so that's the reason why it may not be covered as in depth as what you may expect, because it's already covered in statute, so it doesn't need to be incorporated into the rule. But yes, absolutely, we'll be following all of those provisions of the statute in addition to federal law.
Just to orient members to. Senator Benson found that in the packet of materials that we have in front of us in the first section of all of those rules that are promulgated.
So wanted to go over quickly kind of the eligible entities, so who is eligible to be a consumer assistance partner. And so this references just specifically navigators, in-person assisters, and certified application counselors. So what's not included in this group of consumer assistance partners is agents and brokers. They have a separate definition, so we could keep the two of those. They do have different requirements. Consumer assistance partners can be community organizations and nonprofits, various associations, farming organizations, religious organizations, chambers of commerce, insurance producers, as long as they don't have a conflict. And what that conflict means is that they cannot receive compensation directly or indirectly from a carrier, either for plans that are sold through MNsure or outside of MNsure. So that is the federal regulation around insurance producers. But they can operate with MNsure separately, just as an agent and broker, and be compensated by the carriers. They just can't serve in the role of a consumer assistance partner. What's also included is tribal organizations, human services organizations, including the counties, can also serve in these roles, and others, so company HR departments, libraries, healthcare providers, tax preparers. It's a broad category of people that can serve as assisters. Consumer assistance partners may not, and this is per federal regulation, be a health insurer, be an association that includes members of or lobbies on behalf of the insurance industry, or receives compensation directly or indirectly from a health insurer. But they, again, as I mentioned, they can work with MNsure in their capacity as an insurance producer, just not as a consumer assistance partner, and be paid by MNsure. Consumer assistance partners must, and this is referenced in the rule, carry out responsibilities specified in state and federal law and by MNsure, provide fair and impartial information, so they cannot make recommendations or recommend specific products over others, demonstrate connections to or the ability to establish connections with populations that are served by MNsure, complete the training program and certification agreement, and comply with various privacy and security requirements. So the funding for these four organizations does come in a couple of different formats. For the Navigator program, as I mentioned, that is covered by the MNCA program for 2014. Under that funding, it has a $25 per enrollment in Medicaid, and these organizations can also be in-person assisters. For in-person assisters, there are a few different funding sources. The first is the $4 million infrastructure grants that organizations can apply for. The closing date for those applications was last Friday on the 19th, and we will be awarding those on or before August 23rd. There's also a $70 per QHP enrollment payment, and again, QHPs are the qualified health plans payments, so non-public program enrollment, they can get that payment as well. We are also in the process right now of finalizing payments for Minnesota Care enrollment. As you may remember, there was funding included in the HHS Omnibus bill to fund in-person assister work for Minnesota Care, and we are working on what dollar amount that will be, and that will also operate under the in-person assister program and not the MNCA program. Counties can receive and can serve in the in-person assister role. So they are currently providing assistance to medical assistance enrollees. We are encouraging counties to become in-person assisters as well, primarily because we know that there will be mixed families that are coming to MNsure. And what I mean by that is that you may have kids that are eligible for Medicaid, given that the income limit goes up to 275% of poverty. At that level, their parents would be eligible for tax credits. And so we will have mixed families coming in. It would be beneficial if the family could get help in one place. And so we are encouraging the counties to serve in both of those roles. And then lastly, there's a supplemental. There's a $1.6 million in federal funding for federally qualified health centers. That was announced last week. All of our federally qualified health centers received that funding. Those federally qualified health centers, they also need to go through our training program. That's one of the requirements for receiving that federal grant funding, and so they will be going through that training as well to also get access to our system. And then the certified application counselors, as I mentioned previously, they are not paid by health insurers or MNsure or the state for that service, and then insurance producers would be paid by the carriers.
And this was for calendar year 2014 only. Once we get to 15, again, we have to work on policies and procedures, but it'll be a much more streamlined. It'll probably eliminate the distinction between navigators and in-person assisters, and
that's correct, Mr. Chair.
Yeah. Senator Benson.
Thank you, Mr. Chair. And Ms. Malmov, I want to, I'm trying to shake off some cobwebs and remember, but the $25 per Medicaid enrollee, so you already have to be a qualified Medicaid enrollee in order to access that money. Is that correct? Because part of the reason we couldn't have a nonprofit run MNsure was because we needed to have qualified Medicaid enrollment oversight. And so to be a qualified Medicaid enrollee, can you remind me who those groups are that are already qualified as Medicaid enrollees?
Yeah, so,
Ms. Malmlov.
Mr. Chair and Senator Benson, there are, and DHS can, I know they're here too as well, they can correct me if I'm wrong, there are over 900 MNCA organizations. Not all of them receive funding. Actually, the majority of them do not receive funding. They actually serve more similarly to certified application counselors that we will have through MNsure. But those that do get paid, they receive a payment per successful enrollment into Medicaid. And so that's the funding that's there, and to my understanding, that's set in statute.
But you're blending a couple of issues there, and the cobwebs are, they're a little thick these days. But the issue with we couldn't have a nonprofit running MNsure is because for federal rules, the final determination about a Medicaid enrollment has to be a public entity that makes that determination. And so even with these MNCA assisters out there, the final determination is with DHS for a Medicaid enrollment, and that's the other issue that's going on and played a role in how we established the governance of MNsure. Senator Benson.
Thank you, Mr. Chair. A follow-up, and I'm going to try to kind of collect. Let me be very succinct. I want to make sure we're not paying somebody to do something they should already be doing. And let me step back just a little bit. Part of the rollout of MNsure, of the exchange program, was to have integrated online eligibility. So you would be giving somebody information. A citizen who wanted to apply for benefits in the state would be giving a certain data set to an enrollment entity. And just another part of that would be to determine if they were eligible for enrollment in the healthcare portion of the exchange or in Medicaid. And so I'm going to need some clarification that they're not already going to be doing this work.
Mr. Chair, Senator Benson, I think I'm now understanding your question. So the organizations that are providing information and facilitating enrollment, they themselves are not determining eligibility. The system itself and MNsure in cooperation with DHS is making the eligibility determination. What they are doing is facilitating the enrollment, providing impartial information to help them get through the process. They are not doing anything additional or different than what they are doing today. So they are essentially providing that help to go through the system for that individual.
And
Senator Benson.
so, Mr. Chair, my concern is right now, without the exchange, they're collecting data, information, and pushing that to DHS for determination of the eligibility. Is that correct? They will not be doing anything fundamentally different, except that they'll have a web-enabled portal for entering the information. So why are we paying them to do something they're already doing when, in fact, having a web portal probably makes it easier? I've seen the forms. It's a headache. It's probably going to get easier, and I'm not sure we need to pay them additional dollars. And so please straighten this out for me.
Ms. Malmlov.
Mr. Chair, Senator Benson. So what was very clear in the statute that we have been very making sure that we are very closely adhering to is making sure that people are not getting paid double for doing the same service. And so what's existing in statute today is they get paid $25 for completing a successful enrollment. That will exist into 2014. For the in-person assisters, they would get paid for successful enrollment into QHPs. So the funding that is coming from the federal government for that assistance is not going to be added on top of that $25. That is the payment they receive today under statute, so there is no additional funding on top of that.
And that is what's in statute now. And, I mean, I can, on the one hand, understand if these entities were playing a very passive role and just waiting for somebody to show up and just keying something into a web-based portal, you know, I mean, I can see your point, but that's not how they're going to be operating. In order for this to be successful, this outreach to underserved populations, I mean, 60% of our uninsured are eligible for public programs today. There's a huge amount of work that we need to do to get into these communities and make sure that people understand what's happening. And these same partners that are going to be able to help them through the process are going to be doing a lot of that outreach and making sure that communities understand the benefits of stepping forward and getting. So, I mean, truthfully, the $25 is probably shy of what's really justified in terms of compensating them for the level of effort that they're going to be putting forward to find people and successful Medicaid enrollments.
To that point, Mr. Chair, if I may, we are paying for marketing and outreach in another part of the budget. So we've got two things going on here. My concern was they're already responsible for collecting this data, getting out into their communities for existing programs, and they're being compensated for those programs. I wanted to ensure we weren't stacking a compensation, and it sounds like we're not. And so I just wanted that clarity that we are not stacking compensation for work that they are fundamentally already doing.
And we did put that specifically in the statute as well. We were worried about that as well. Ms. Malmlov.
So I just wanted to talk about the timeline that we are working under for the assister organizations to get up and running. So as I mentioned, we put out the proposed rule on April 1st. We finalized that rule on April 29th. May 28th is when we released the solicitation for the grant application, so the infrastructure and outreach grants, the $4 million that are available for those organizations. That went out on May 28th. We also on May 28th asked assister organizations and agents and brokers to let us know that they want to work with MNsure. And so there was an application for assisters to submit to be able to work with MNsure. And we asked agents and brokers to submit a letter of intent of their desire to work with us. And they could start submitting those applications and letters of intent on June 3rd. That's a rolling process. There is no deadline. And so people can continue to submit those over time. And we are very much encouraging that. Our grant applications for the $4 million were due on July 19th. We will be awarding those on or before August 23rd. And the training and certification will come for the assister organizations and for agents and brokers in the months of August and September. And I'll go over a little bit kind of what that training includes in a few slides. So one, just want to talk a little bit about the grants that we will be awarding here towards the end of August. There's up to $4 million that are available in the first year, and we do anticipate this will be an ongoing grant program that will exist for these organizations. The awards will range generally from $2,000 to $200,000, depending on what the need of the organization is. We are specifically not funding, to Senator Benson's question, existing resources that those organizations already have. We are asking how they are currently funded. We are funding funding additional infrastructure that they may need to perform these functions. We also are also looking at awarding up to $500,000 for coalitions. We are encouraging coalitions to come in to serve a larger geographic area and to encourage coordinated work for those assisters. The contract period is through September of 2014. And again, due on July 19th, and we will be awarding them by August 23rd.
So do you, so you've already received all that you're going to on this first round?
That's correct, Mr. Chair.
I know it's not public yet, but are you encouraged by what you've seen as far as the individuals that have stepped forward and asked to be partners?
We are very encouraged with what we've seen. We are still kind of going through that information that came in later in the day on Friday, but do have a substantial number of organizations and agents and brokers that have come in both on letters of intent applications and the grant applications. So we have a huge deluge that came in on Friday of those for those organizations.
Good.
Senator Laurie. Yeah.
Senator Sharon.
Can you talk about, it's $4 million. You can't, you're getting a deluge of requests that you cannot meet with $4 million, I assume. And so how are you distributing those grant dollars geographically?
Ms. Malmlov.
So under, Mr. Chair and Senator Sharon, so under the grant program, we have really stressed that we are looking for broad geographic distribution. So that's one of our key awarding criteria, is making sure that every single state of every single region of the state is covered. We have also put a high priority on underserved populations. So we have shared with all of the applicant organizations where the uninsured are located, have worked with SHADAC to get that information out to everyone, and we are prioritizing underserved populations, populations of color, serving very small employers, and are really making sure that we have geographic reach, but also in the areas that have the highest need.
May I follow up?
Senator Sharon.
How short are you against the demand?
Ms. Malmlov.
Mr. Chair, Senator Sharon, we just got them in on Friday, so at this point have not had a chance yet to total up what we think the entirety of the need was. One thing I will say is when we were looking at establishing how the program, the assister program would be structured, in total, without the funding from DHS for Minnesota Care, it's about $11 million, which going into the future is about 20 to 25% of our budget. We do understand that there may be more need there, but to stay kind of within our budget, I wanted to make sure that we established something that was sustainable over time and could be funded through the withhold that was coming in.
Right.
So how the grants are structured is actually there are three different types of grants, or three ways to get a grant. The first one is just for outreach. So an organization can apply just to get outreach funding if they choose to do so. And again, that outreach funding is targeted to hard-to-reach populations, geographic locations. We're looking at innovative models for how to do outreach and how to cost-effectively do that, and unbiased information. So we were not prescriptive in what we were asking for. We're really looking for innovative ideas and know that different parts of the state and for different populations, different ideas may work differently. And we are very much encouraging seeing those ideas. The second opportunity that's there to get a grant is infrastructure grants, and these are for infrastructural technology and support needs. Could be for staffing, computers, facility space, that type of thing. And then the third opportunity is a combination, so you can have outreach and infrastructure together for organizations that have the capacity to do both. And we very much encourage coalitions, and so that organizations that are doing outreach are very closely tied to those that are doing enrollment, so that there is the connection. If you find someone, you can get them easily to someone that can help them get enrolled. So as I mentioned previously, our training program is going to go August.
Senator Laurie, I'm sorry. Before you leave this subject, you've just completed getting the requests. When will we be able to see how these dollars are distributed? When do you anticipate those decisions to be made?
Before August 23rd, and we want to get them out as soon as we possibly can.
And will that be something provided to us?
Yes.
I'd like to see it. Thank you.
So on training, we are on a very accelerated training timeline, as all of the states are. So this will be occurring through August and September. Training is going to be online, and we figured that was the easiest way to get many people trained at one time. It is online. It will be self-directed. So people can take that at their own pace, sitting at their computer. They can do it at 2 a.m. if they would like to do so, and can take as short or as long as they think that they need for that training. And they will need to pass a competency test at the end of each of those modules. The modules are being finalized right now and being put together. They will include a variety of things that are specified in the rule, including an online tool training on the online tool, including privacy and security issues with that. They also receive training on the ACA generally and what are the provisions of the ACA, including, again, privacy and security. Will receive training on public programs and the financial assistance that is available through the tax credits. QHP, and this is the qualified health plans that will be available through MNsure, what it takes to be eligible for those and how to enroll people in those. We will also be training people on Minnesota law related to producer licensure requirements, and this is for consumer assistance partners so that they know when they don't cross that line into being an insurance producer. There's also a bulletin that was put out jointly by MNsure and by the Department of Commerce earlier this summer that does explain what that line is. And essentially that line, what that line is that an in-person assister cannot provide recommendation or advice as to which product to select, but they can provide impartial information and describe the terms of a policy or contract. And then lastly, a module will also include defined contribution. And this really is, defined contribution, just as a reminder, is employers being able to set aside a dollar amount for employees to pick the plan that they would like to pick, as opposed to a defined benefit plan where the employer picks the benefit plan for all of their employees to enroll in. And so some training on what federal law does and does not allow for defined contribution. Training, as I mentioned, will be conducted online. In 2014, the training is free. We have the ability to evaluate that going into the future. And again, it's self-directed at their own pace. And we are providing the opportunity for third parties to be able to do that training for organizations if they would like to. They can charge a fee for that training, but the participants will still need to pass our online competency test. So there is the ability to get additional or separate training using our materials if someone wants to provide that in person, for example. So next, I wanted to talk a bit about the IT and the business application and where we are in that process. As we have, I think, talked about before during the legislative session, really what we designed the IT system to do was really as modules or as components that are kind of plug and play. In the evaluation that we did in both establishing the RFP and in selecting vendors, it was very clear that there was not one vendor that could do every single functionality that MNsure would need to do, and so we did need to bring in modules that different vendors would do different services. And so really it is established as a way to be able to plug and play and replace and match with different functionality. And so our application structure, our contract is with Maximus. They are the principal lead on the project. Underneath that, EngagePoint is doing systems integration, both integration between the different modular products that comprise the IT system, as well as system integration with our existing systems within the state. We need to connect to SURF is at the Department of Commerce that does the rate and form filing submission from the plans. We need to connect to systems at DHS that will store eligibility and enrollment information that is used to pay both providers and carriers, and also we'll have some connections to some data sets within Minnesota that we can use for eligibility, so they will be doing that integration. And then the products themselves, we did buy existing software products that will provide lower risk for us getting up on time. So there are products that already exist. We've been working to configure them to match Minnesota requirements and some upgrades to comply with the ACA. And so those three companies include IBM Currem. They are doing the eligibility components of the IT system. Connecture is doing the components related to plan shopping and enrollment. And EngagePoint is also doing the premium payment aspect of MNsure as well, and kind of account management for individuals to be able to manage their own account. The architecture has a lot of moving pieces in it. In addition to our business application infrastructure for MNsure, there are also 40 different pieces of software that are operating underneath that allows it to run. And those different pieces of software do things such as identity management, making sure that people are who they say they are when they are accessing the system and cross-checking that. There is software that will also be managing documents. It's a system called FileNet, and so when people submit in documents, it will make sure that those are all connected. Those are just a few examples of the different pieces of software that need to operate underneath the business application. This picture and this structure identifies all of the different layers of the IT system that is here, and I won't get into this in depth because I know Minute will be able to talk about this in much greater and educated detail than I will be able to, but did want to highlight kind of the extent to which this system will do a variety of functions and is much more than just a website.
Senator Benson.
Thank you, Mr. Chair and Ms. Malmlov. I'm looking through these layers, and I see the integration layer, the engage point integration layer, the broad yellow band, integrating data from a number of sources, including a federal data hub. Does the federal data hub information flow into Minnesota and then reside here, or are we sending information out? Again, it's that Chapter 13 issue. As long as it stays under the control of Minnesota purview, then we have data protection for our citizens using these systems. The second it drops outside our control, it reverts to a much weaker data protection.
Ms. Malmlov.
So, Mr. Chair, Senator Benson, how the Data Hub works, the Federal Data Services Hub, is it is used as a verification source. And so we will be able to essentially pull in federal data into our system to verify the information that we get from individuals from those sources. And so that information will stay here as a verification for that. The only information that we will be sending to the federal government is information on what's called an 834. It's enrollment information. We need to share that with the federal government so that they know that someone is actually enrolled, and it's a trigger for them to send the tax credit dollar amounts to the carriers. And so once someone is actually enrolled, they will send tax credit dollars to the carriers for that successful enrollment. So we do need to share that information because it is a trigger for that funding.
But we also, in the statute itself, made clear that all of Chapter 13 does apply to all of the transactions and the operations of MNsure. Senator Benson.
Right, and thank you, Senator Laurie, and I'm aware, but as soon as it crosses that federal line, Chapter 13 doesn't apply anymore. And so I'm just curious as to what 834 data, could you give us some examples of what that 834 data looks like? And can the federal government change those rules? Is it an HHS or federal rulemaking authority that sets what 834 data is, or is that in statute somewhere? How do we know if that data set changes?
So, Mr. Chair, Senator Benson, I will try to answer that, but the specifics, I brought our general counsel up, Mike Turpin, who's working mostly on privacy and security related issues to this. So the 834 is really an enrollment file, so it'll have name, address, age, those types of things included in that. But Mike, if you want to reference any other pieces.
Welcome to the committee. State your name for the record.
My name is Mike Turpin. I'm MNsure General Counsel. Mr. Chair, members of the committee. An 834 is a standard transaction, and there are specific details within that that are identified. It's an outgrowth of HIPAA, and so there are standards specific as to what that information is. It's commonly used within the private market as well as the public market to identify enrollment details. And as Ms. Malmlov said, it is indeed demographic information about the specifics around the plan, enrolled, details such as that. And just to be specific as well, the 834 would only be shared in those instances when an individual has actually requested a tax subsidy. So the 834 information is necessary, as explained earlier, to allow that those federal dollars to, or the tax credit dollars to flow to the specific health carrier that individual has selected. So it really is necessary to complete the connection that an individual has initiated through their choice. So in other words, they've specifically chosen to request this subsidy. they've been determined eligible for that subsidy, they've actually selected the plan that they would like to choose. This allows that health carrier providing that plan to receive those funds.
Senator Benson.
Okay, and thank you, Mr. Chair. Mr. Turpin, so do we inform the person that because they've requested this federal subsidy, this data set is going to the federal government?
Mr. Chair, Senator Benson, we do. In fact, we provide a Tennyson warning at the point of enrollment, and it is actually separate from the. We have several stages of Tennyson warnings because we do want to make clear, instead of providing a high-level overview of all the information, we really want to provide just-in-time information so that individuals can make informed decisions.
Okay, thank you. And
Senator Lori.
If I can, just really quick follow-up. Mr. Chair and Mr. Turpin, Ms. Malmlov, the President at one point made a comment about smart government and how by having health information available to citizens, they can make better health care choices. And so that kind of got me thinking a little bit. I just want some surety that these 834 HIPAA-required data transactions will not include any health care information.
Mr. Turpin.
Mr. Chair, Senator Benson, I think to your question, I think I'm understanding your question to be information about an individual's health status or something to that effect, correct?
Right. Yes.
And no, the 834 transactions do not include that information.
And we had quite a bit of debate about this throughout the process. In fact, we took some amendments on the Senate floor that said that specifically, and we got hung up with some of the vernacular that we're just using, and we throw out health information. It turns out that health insurance status, whether you're insured or not, is health information, and so we weren't able to maintain that one line, but I can't remember, we came up with something else, but I mean, your health status, your health records, what we think of in common usage like that is not going to be shared. But there are some things, I believe smoking status is considered health information. So some of these things that are, it's one of the 3 rating things. So we have to be careful when using terminology about what's there and what's not there. But information about your health, as we commonly think of it, will not be shared on that 834.
And Mr. Chair, I appreciate your comments. However, and I've said this over and over again, we are ceding a lot of control to the federal government, and right now they're not asking for that information. But if they decide to make a rule change, if Secretary Sebelius decides she needs a rule change and that the 834 data is going to include some of that information, I just want to make sure that we have some sort of trigger so that the legislature here knows and so that the state of Minnesota knows that that rule change is going to impact us. And it sounds like conspiracy and black helicopters and so forth, but we see rule changes happening all the time without congressional oversight. The legislature at some point has to be informed, and so I just want to be very clear with our general counsel, with Ms. Malmlov, the members of the board, that it is a concern that if there's a federal rule change, while it might seem innocuous, at least to be informed.
Yep. Very good. Senator Sharon, you had?
You've already covered what I was going to say.
All right. Mr. Chair. Ms. Malmlov? Representative Hoppe.
Thank you, Mr. Chair. Since it came up, if somebody applies for a tax credit, and I don't know, either one of you can answer this, and that will go to the IRS naturally because they're handling taxes, does the tax credit come back through the carrier, or does it go directly to the person?
Ms. Malmlov?
Mr. Chair, Representative Hoppe, so the tax credit is sent directly to the carriers. It doesn't go through MNsure and does not go through the individual. It's advanceable directly to the carrier.
Okay, and one follow-up question, and I didn't hear this, and it might have been covered, but who checks the eligibility to make sure that a person is eligible for the tax credit? Is that dependent on IRS or MNsure or the carrier or the individual?
Ms. Malmlov?
So, Mr. Chair, Representative Hoppe, so the eligibility for that has multiple components. One includes income, citizenship, a whole host of other things. That is what MNsure will be doing, and be verifying that information against the Federal Data Hub, including some other sources as well. I don't know, Mike, if you wanted to add any other details related to that.
But the nature of the advanced premium tax credit itself, the final determination on that rests with the IRS, and it will be reconciled at the end of the tax year. And that is actually a pretty significant question that you're bringing up, because if it was if the income that the individual was using during the application turns out not to be correct, I mean, there's actually a risk of tax penalties at the end of the year. So it's reconciled at the end of the year. The final determination rests with the IRS, if I'm correct.
Mr. Chair, that's correct.
Senator Laurie? And is that...
Senator Sharon.
I'm trying, as the process goes forward, is the person, as they're going through this process of selecting a product and understanding what the cost will be to them, will they know an approximation of what that tax credit is that's going to the insurer? They see a number, an actual number, reduces their premium by that amount of money.
Ms. Malmlov.
Yes, Mr. Chair, Senator Sharon, they will see what the max amount that they are eligible for the tax credit, and they can choose to not take that full amount if they choose to do so. So if they know, for example, that their income might change throughout the year and they want to take a lesser amount, they are able to do that to lessen the potential tax burden that they might have at the end of the year. So there is flexibility for the individual to choose how much of that they want to take.
Mr. Chair,
Representative Hoppe.
thank you. Following up on Senator Sharon and your questions, just to make sure I'm clear and we're clear, so then does MNsure at the point of enrollment, the navigator or MNsure itself, verify eligibility, verify income, and then report that to the IRS? Or is the IRS going to be checking back with MNsure, or is there a reporting mechanism somehow?
Mr. Chair and Representative Hoppe, so yes, MNsure will be doing that verification of eligibility and checking that against the Federal Data Services Hub. Once enrollment is actually effectuated, then that enrollment information is sent to the hub, and so that will send out the tax credit information. So there is reconciliation that is done between MNsure and the Federal Data Services Hub, which includes connections to IRS, Social Security, and other agencies.
And this issue is going to be a fairly substantial portion of the training that'll be for our partners as well, to understand the nature of the advanced premium tax credits and make sure that this is well understood between those entities helping to enroll and the person signing up for assistance and the possible tax credits, so that we have, as full of an understanding as we can ahead of time for those individuals signing up for plans and for tax credits. Correct?
Yes, Mr. Chair.
Representative Laffer.
Thank you, Mr. Chair, and sorry I had to be at another commission meeting, so I missed some of the presentation. But I think really what's really going to be important is now with the new federal tax credits, for people to really understand and be reminded frequently that changes in their circumstance have to be reported, or they need to check in. I think, even just with our long-term disabled population, it's a challenge sometimes to keep up with changes. Their hours might increase, whatever, from 10 hours to 15, and that doesn't seem like much of a change for most of us, but it's just enough to make a little bit of difference. And particularly for the working poor who may have jobs that fluctuate seasonally in terms of demand, often are subject to changes in their economic situation, it does put them at a little bit of risk if they don't keep the system kind of up to date. And I really hope that as we're training our navigators and others, and in our public outreach and education materials, it sometimes can be overwhelming to get that information just at the first point of contact when you're just kind of lost in all the details. So if we can make sure that that's a priority, I think we can help avoid some headaches later on.
Mr. Chair, Representative Loeffler, I remember you making that point during the legislative session, so we have definitely kept that in mind.
All right.
Also wanted to talk just a little bit about You had asked for status, so where we are on the IT infrastructure in working with the federal government. So I wanted to just do a really quick overview of the federal review structure. So what you'll see on this page is all of the different reviews that we need to go through with the federal government. They are essentially called stage gate reviews, and we go through these, and once we pass them, we are allowed to go to the next level. We recently had a review on June 18th. Where we were demonstrating some functionality. We have taped some of that functionality and do have that available on our website, so you can see how the system is working. We also showed that video at one of our most recent board meetings as well, just to give a sense of how the system is working. We do have ongoing reviews throughout the summer that will be looking at where we are at with development, doing a testing of the implementation of the system as well. And so there is a process through which those reviews are happening with the federal government. And so on that timeline, what we have discussed with the federal government and also shared with our board is kind of where we are at for 10-1 and what will be happening post 10-1. As you can appreciate, getting something up of this magnitude during the period of time that we have is a major lift. And so we have prioritized to make sure that the functionality that is needed to make sure that people get coverage and we are able to test for the eligibility of that coverage is front and center to make sure that is working on 10-1. And so where we are at today is that we are finalizing requirements and integration right now. Our final code drop from the vendors will be happening at the end of this month, so we are about a week out from getting that final code drop. They will be doing integration and testing during the month of August and into September as well. We will be fixing any bugs that are found through that testing into September, but we do know that there are some things, some functionality that will need to be added into the future, and some bugs that we will not quite probably be able to fix on 10-1, just given the short time frame that it is that we have. So what we have worked out with our vendors is knowing that there will be needed patches that will need to come over the next year. And so we have pre-planned a patch for additional functionality and what I would call bug fixes in December and January, another one in February and March, and there will be another planned one prior to October 2014. And so some of these things, I'll give you a few examples as to what they might include. One of them, for example, is we will need functionality that will help people make changes based on life event changes. So if someone has a baby or if they get married, they will need to make changes to their coverage or add individuals onto that coverage. That functionality won't be in there day one. We've had the vendors focus on other functionality to get up because we don't need it on 10-1. Coverage is not effective until January 1, and so you really don't need to make any changes until the month after January. And so that fix would be coming in the February and March timeframe. So being able to focus on some priority areas, we've been able to make sure that there's less risk up front for 10-1 and getting that core functionality up, and we have delayed some of that other functionality to later releases to when we actually will need it. And so we do have a structure there that will set that up. So we would expect that there will be 3 additional releases that will be coming to the system after 10-1.
All right, Senator Benson, and I know that your board meets for 4 hours, but we're legislators. We get, I was hoping to keep this to around 2 hours, so we're going to try to pick up the pace a little bit. I know we had a couple of questions for Commerce. I know minute is coming up, but this is really good material and helpful. But
Thank you, Senator Lori, and I keep asking the questions because it's been a long time since we've looked at this. I was wondering how the federal delay of the employer requirement has impacted. We haven't addressed that at all. And that was a pretty significant change, and I was wondering if it...
Ms. Malmlov.
Mr. Chair, Senator Benson, from a functionality standpoint, we really don't think it impacts us much at all, except in one area, potentially. We are in conversations with the federal government right now to understand whether there's a piece of functionality that we have to have operational right away or if we can wait a year for that. And what that functionality is if there is an individual that is eligible for tax credits through MNsure and they work for a large employer, we need to be able to communicate that both to the IRS and to the employer. But if there's no penalty going to be assessed, we have been asking whether or not we actually need to provide that service, if that's going to be informational for the first year, if that can be delayed. And so we are still in conversations about that. We don't yet have an answer, but that would be the extent of what that would, how that would impact us.
Representative Huntley.
Yeah, a follow-up on that, Ms. Malmlov. Which, obviously this won't take place until 2015, but which department of state government is going to be in charge of checking to make sure the employer in 2015 is offering help on insurance? Is that going to be, and since our laws say that Minnesota can enforce the federal laws, who's going to be in charge of that particular item? Commerce, revenue?
Mr. Chair,
Sure.
Mr. Chair, Representative Huntley, so I might have a few different answers. I'm hoping I'm answering your question. So there is information on employer-based coverage will start to come through federal reporting. I think it's through W-2 or some other federal reporting that will kind of report what coverage you have through that mechanism. What MNsure is required to do is collect information on who the employer is and do some auditing of those individuals to kind of check on what that coverage is and if they have that coverage that's there. But that information would be available to the federal government for the establishment of those penalties through those reporting forms, which to my understanding is one of the reasons for the delay is for that reporting from employers through those forms.
So basically, if I understand this, Mr. Chair, that it's the federal government that would be watching this particular item.
Mr. Chair, Representative Huntley, primarily. But we do have a reporting function to let employers know that they might have someone who's getting a tax credit.
Mr. Chair?
Representative Hoppe.
I've got a couple of questions, and I know we're running short of time, but when we talk about that, and Representative Huntley mentioned it for the employers, what about the individual? The penalty, will there be a penalty? Is it going to be assessed? If I'm a young, healthy individual that is looking at getting on this program, would there be an incentive for me to just pay the penalty and not get the insurance?
Ms. Malmlov.
Mr. Chair, Representative Hoppe. The individual mandate, the penalty for not having coverage is effective for the first year. What MNsure is responsible for in doing that is MNsure would be providing, people can apply for exemptions from needing to have insurance through MNsure. There's a variety of categories of what that exemption would be. MNsure can evaluate those and determine whether or not someone can get an exemption from that. The actual tax penalty itself will be assessed by the IRS through the tax filing.
Representative Loeffler.
Well, and I'm just in awe of all the computer complexity that you have to get going up and operational, and I'm impressed with your planning to date. I'm hoping you can squeeze in just sort of a reality test of some actual users, some small businesses, or you know, people who insurance is confusing to most people. And all the terminology, those of us who've mastered copays versus deductibles versus, you know, co-insurance, all those sorts of things, it's going to be a brave new world for a lot of people. And I just think testing it out, just to see if the language works, might reduce the demand on your 800 call center and other issues if we just kind of make sure that we've got, you know, the right pop-up definitions or whatever to help people through.
Mr. Chair, Representative Loeffler, as you can see from the timeline, the window for testing is very short, but we have put a priority on making sure that we are doing testing for limited English proficiency, and so we are spending a lot of work on that to make sure that the language that's there is understandable. In terms of doing a lot of user testing, there's not a lot of time that is there, but we do have a plan going into 2014 to do quite a bit of user testing on the system to help inform any changes that we would make for 2015.
Mr. Chair?
Yeah. Representative Hoppe.
Again, just probably my last questions here. I think for our committee's perspective, I would like to see a total budget. I think we need to know as soon as possible the estimates on enrollees, the high, the medium, the low, And I don't know, does the chair isn't here anymore, I don't think, but does the board have a budget? I mean, are there people that are looking at the numbers? We saw a lot of things about the costs and the money that's being allocated to go out. Not a whole lot. I mean, that's half a budget. We need to know enrollees, we need to know revenue, we need to know how this thing is going to work. I would also like to see, I know there's a lot of new employees coming in, but I think that this committee should see an organizational chart. And I think I'd like to see that sooner rather than later, all of those things. And I think Senator Sharon brought this up earlier. I don't know when we're slated to meet again. I think you and Representative Atkins will probably work that out, but I think sooner is better than later. And I think there are a lot of questions here that need to be answered. And I don't know if, Ms. Malmlov, if you want to take a stab at any of those or wait for the chair or the next meeting, but I think this committee needs to know those things.
Ms. Mamlov.
Mr. Chair, Representative Hoppe, I can answer generally, and we can follow up with information. So we do have our grant application that is going in on August 15th. That will have detail about the grant about the budget for that. Also, that includes a self-sustainability plan as well that will have information on budget going into the future. Will be included in that. We will be presenting that to our board on August 7th. The board also, under their policies and procedures that they are working on to date and have adopted, some of them will also be reviewing our budget and approving that annually. And I know that this committee as well will be reviewing those budgets after the board has reviewed that. And so once the board does get their transition of authority, I am sure that will be one of their first things, is to look at the budget and approve the budget into the future, and that would be available to this committee.
Thank you. And two more. Oh, go ahead.
The org chart, did you?
Oh, yeah. And Mr. Chair, and Representative Hoppe, we can absolutely provide you with an org chart.
Okay.
Representative Hoppe.
Thank you. And I mean, both the organizational chart and the budget, I'm really curious about the enrollee numbers and your projections, both high and low.
Yep.
And then I think we've talked a lot about what's going to happen and all the money that's being spent in the systems that are being in place. But can you give us just a thumbnail sketch of who you're planning to serve, who the projected, just for the people on the committee and the people watching, so people know who you think your potential customers are, and then what products are they going to be looking at?
Ms. Mamlov.
Mr. Chair, Representative Hoppe, so a broad brush. So the numbers for 2016, so full enrollment, and there is a ramp-up period prior to that, but full enrollment is over 1.3 million people. That includes, and this is with the changes to Minnesota Care, so that includes about 700,000 individuals on Medicaid, I think around 180,000 or so-ish on Minnesota Care, about 150,000 small group employees in small groups, and about 300,000 individuals either getting tax credits or coming into the system without tax credits. So that's kind of the broad brush of where that enrollment is coming in. In terms of the plans that will be available to them, really I would defer that to the Department of Commerce. I know they will be talking later. We are not at this point privy to that information. That has been filed, and so it's non-public information that's currently under review by the Department of Commerce.
Thank you. And Mr. Chair, one final question or comment for this committee and for your board. From an insurance perspective, there are a lot of numbers there with the people that are going to be involved and enrolled. Insurance doesn't work unless you have young, healthy people that are paying and not really using a lot of it. I don't know. I mean, that's why I want to see the projected enrollees and the numbers as an insurance product, as an insurance from a perspective of the insurance, the carriers. I don't know how this is going to work. And if I'm a young, healthy person, I don't know what it's going to cost me to get insurance through MNsure, but I think that's going to be a lot more expensive than paying a penalty. And I don't know if we give people the option to just pay a substantially lesser amount and not enroll, I think a lot of them are going to do that. Thank you, Mr. Chair.
You're welcome. Senator Nino.
Thank you, Mr. Chair. If you're wrapping up here, I have 3 questions, but if you're not done yet, I don't know if you were going to go through the appeals.
Let's roll through appeals quick. If yours are general questions, I take it, or are they on this point?
Yeah, no, they're not on this point.
Let's go through appeals quickly, and we'll come back your 3 questions, and then get on. Again, we need to hear for a minute. I know that we'd like to hear a little bit from Commerce on the rate and rate filings and plan filings, and then we have 2 individuals from the public who signed up to testify. So on appeals.
So, Mr. Chair, Mike Turpin, our general counsel, is going to go through appeals. I think you should have just received a copy of the proposed rule that went out today. And so Mike is just going to do kind of just a quick overview of what's in that rule and what the process is.
Mr. Turpin.
Mr. Chair, members of the committee, MNsure is required under both state and federal law to provide a process for individuals and entities to appeal any of the determinations that occur through MNsure. State law requires that any of the selection or certification determinations follow the contested case process under Chapter 14. However, eligibility determinations, which will form the vast majority of any determinations, state law directs that we develop a process. The rule that was issued, the proposed rule that was published today, gives an outline of that process and identifies the various procedural rules under that. But at a high level, I want to also address some of the structural organization that will surround the appeals operation within MNsure. For appeals of MNsure eligibility determinations, MNsure will be partnering with the Department of Human Services Appeals Unit. They will actually be acting as the appeals entity for MNsure, and so MNsure has delegated authority to DHS to carry out that function. Individuals who are going to be seeking a MNsure eligibility determination will essentially be presented a single front door, given that DHS would be handling the eligibility determinations related to Medicaid as well. So really it is a single front door intended to be very user-friendly to individuals who are using the MNsure process. MNsure is also collaborating with the Office of Administrative Hearing. Office of Administrative Hearings has been providing invaluable assistance in pulling together some of the procedures and again assisting in making sure that the process we develop is user-friendly and complies with both state and federal law, including all appropriate due process considerations. Here we have somewhat of an outline of the process for eligibility appeals. Individuals would receive a notification of an eligibility determination, which would trigger their right to file an appeal of that determination. The input will occur via multiple modalities, both the ability to file that and submit that appeal online. An individual would also have the ability to file an appeal via fax, email, or in person, or over the phone or in person. The appeals entity would also log that and track that status that someone has filed that appeal, and the process would be triaged to identify the appropriate next steps. A MNsure representative would then, that would trigger the ability of that individual to follow up, see if there's ways to sort of resolve prior to hearing any issues, but certainly an individual could always avail themselves of their right to continue on to an appeal. Once a decision's made, there is 90 days for MNsure to produce the decision, and the individual would receive that. They would also receive notification of further appeal rights, whether that be under the state judicial process, which would be an appeal up to the Minnesota Court of Appeals of that decision, or for certain types of appeals, the ability to appeal to the Federal Department of Health and Human Services that decision. MNsure is also planning to publish redacted versions of a sample of some of the decisions, moving hopefully towards a broader posting searchable database of those decisions as well. Very quickly, just an overview image of the process. I think maybe more useful is some of the information we're going to provide to the public in an attempt, again, to try and make this user-friendly. Identify that you're receiving a notice that tells you that you can appeal, some of the ways that you can proceed with that appeal should you want to file that, various timelines, various information about preparing for the hearing itself, information about the hearing in front of the judge, and then information about next steps. During this process, as I had said earlier, the proposed rule we have identifies all the due process protections afforded to appellants under state and federal law. various things such as the right to request review of their appeals records in advance of the hearing, the ability to submit evidence to be considered in the hearing, the ability to cross-examine witnesses, and the ability to be represented by counsel at such hearing. MNsure is also making sure that we have these hearings be fully accessible to individuals with disabilities and or limited English proficiency.
All right. That's appeals. I think general question would be in order. Senator Nenow?
Yeah, actually, I do have one going back
Okay.
onto page 5 regarding the premium tax, or withhold, or whatever we want to call it. And I think this is going to spill over into commerce. So if we have anybody from commerce, it would be good to come down. On page 5 and page 6, it talks about up to 1.5% of the MNsure premiums and up to 3.5% of the MNsure premiums. Is it possible to just allocate that percentage, that 3.5%, just to the products available in MNsure, or is it possible to separate those out and it applies just to those products sold through the exchange, or not? The implication here is that yes, it would just apply to MNsure premiums, MNsure products, but I don't know if that's possible. Is it?
Mr. Chair and Senator Nenow, I would absolutely leave it, have Commerce talk about this as well. But from our perspective, it's very much an administrative cost for the plans and could be distributed internally. At least the advice we have from the federal government could be distributed internally based on where those administrative costs lie. Think of it very similarly to broker fees, for example. Not everyone uses a broker, but there are broker fees that are distributed internally based on administrative costs of where they lie. In terms of, from a regulatory perspective, where that sits and how that's counted, I would leave that up to the Department of Commerce to address that issue.
Do we have anyone here from commerce?
Yeah.
On the
Mr.
agenda.
Brickwitty, welcome to the committee.
Mr. Chairman, Peter Brickwitty, Director of Government Affairs for the Department of Commerce. Senator Nenow, I think Ms. Todd-Malmlov just answered the question quite succinctly there. Administrative costs for the plans and how those are allocated are part of the rate and form filing determination that would go on with any product that's filed with the Department of Commerce or with the Department of Health, for that matter.
But correct me if I'm wrong, it's not possible to, or maybe it is. Is it or isn't it possible to have a different rate for the same product that happened to get sold through MNsure versus one that gets sold through a broker? It's not.
Mr. Chairman, Senator Nenow, I try to make it a practice not to ever tell a member of the legislature that they're wrong. In this case, however, products sold inside and outside of the exchange that are identical have to be priced in an identical fashion.
And that would require an allocation.
Thank you, Mr. Chair. And that was my assumption. This isn't for commerce, but I may have a follow-up for you.
I won't go for it.
If we had the full 3.5% tax withhold, whatever, how much would that raise in totality? Roughly.
Ms. Malmlov.
Right. Mr. Chair and Senator Nenow, so the projections that we have, and again, this is based on kind of what the final premium levels are that come out from the filings, which we have not yet seen. But the projections that are there, it would raise roughly, at least in the first few years, about $40 million.
And it's dependent on the level of enrollment that we actually see on the exchange, which is why there's an up to. So when we set budgets and have a better bead on who's actually going to enroll, it's hard when just working with projections to give a hard number.
And then if the fine gentleman from Commerce could come back up. The other question I had is, with the tax withhold, whatever, whether it's 1% or 3% or whatever, how does that interplay with minimum loss ratios? Does that affect that at all?
Mr. Chairman, Senator Nenow, I don't know specifics. I can get back to you with a better answer after speaking to our rate folks. I suppose I would leave it at that. I don't have a good answer for you right now, but I can follow up with you on that.
Okay, thank you.
The feds have a definitive answer on that. It does not count into your medical loss ratio, if memory serves. We had a I'm pretty sure we had a federal guidance on that that said that the withhold does not count into the medical loss ratio.
Mr. Chairman, I believe that's correct. I just want to double check. I don't have that
do double
federal
check,
reg
'cause-
in my folder. It's in a larger folder back of the office, so I'll double check that, Senator, and get back to you.
Thank you. Different tack now, Mr. Chair. Second question.
Yeah.
Okay.
Senator, now.
Can you kind of walk us, maybe for the sake of the audience members and to refresh our memories, to walk us through the process that was outlined in the legislation for the product selection? You know, who's going to play in the exchange with what products, and are those criteria set yet? If not, when will they be? And
Ms. Malmlov.
Mr. Chair, Senator Nino. So for 2014, if a plan complies with all federal and state requirements and chooses to be offered on MNsure, will be able to be offered on MNsure. Starting for the 2015 calendar year and later, there is the ability for the board to set, essentially select which plans would participate. The process for doing that, we need to engage our board in that process and how they would specify the list of criteria that was included in the legislation once they are transferred full authority. And so that would likely happen or start this fall, likely in October.
And I believe the legislation required that they promulgate rules regarding what the selection criteria would be by February 1st of 2014, basically, for the list of criteria that they might be using to select, and the measurements against which those criteria would be evaluated in order for plans to have a better idea of what they're going to be up against. So February 1st of 2014 will be the first set of rules promulgated regarding what might be in those selection criteria for plans that would become effective January 1, 2015.
Thank you, Mr. Chair. And the process that will be used by the Exchange Board, that's not been determined yet, or?
Mr. Chair and Senator Nino, no, that has not been determined yet. And to Senator Lori's point, that the process and if there are rules needed for that process would need to be done by February 1st, but we do need to have a discussion of that process with the board once they are transferred full authority.
Senator Nino.
Thank you, Mr. Chair. And is there, at least to the best of your knowledge or any conversations that might have taken place so far, is there an expectation that that will be a public process, that maybe the preliminary proposals will come before this group? Any idea at all?
Ms. Mamlov?
Mr. Chair and Senator Nino, we really need to have that conversation with our board. We just literally haven't had any conversations about the selection process yet.
Well, and Senator Nino, that is a very key piece of our MNsure, and so our rules do need to be reported to this oversight committee, and I for one take our role very seriously. So I would anticipate and hold the chairs to account for making sure that we have a hearing on that before those become effective. I think that's a key piece of our oversight work that I'll commit to you, to making sure that we have that ability to see those and ask questions and meet before those become effective.
And last question, Mr. Chair.
Yep.
And this kind of ties back into the funding again, but the DHS cost allocation, is that the chargeback for determining those eligible for Medicaid that are coming in through the exchange? Is that exactly what that is?
Ms. Mamlov.
Mr. Chair, Senator Nino, the DHS cost allocation is essentially cost allocated to Medicaid for the benefit that they get from the eligibility and the other pieces of that system. So that's allocated to DHS, and then they get federal match for the bulk of being able to do that. Yes.
And how much is that? Are we expecting that cost allocation will be that the exchange will receive from DHS?
Mr. Chair, Senator Nino, if I'm remembering correctly, there's 2 cost allocations that will be going forward in the future, one to Minnesota Care and one to Medicaid, and together, if I am remembering correctly, but we can follow up and make sure that you get the actual numbers too, is I think somewhere between 15 and 20 million between those 2 programs.
Senator
And
Nino.
will that amount cover the entire cost of providing that service to this contingent of people? I don't know, 1 million people or whatever the number is.
That will cover the cost of what goes through MNsure for that component piece. What is not included in that is existing spending that DHS and the counties have for customer service. For example, that is being done, existing to be done through DHS and the counties. That's not included in that cost allocation amount. So, for example, there already today, the counties, for example, there's about $100 million spent on work that counties do related to helping individuals, half of that coming through county revenue that is matched by the federal government. That is not included in this amount. That is separate.
Senator Benson?
Thank you, Mr. Chair. We haven't talked at all about MSHA and what's going on. Are we going to have a later hearing where somebody will present what's going on with MSHA, or is that something that can be addressed briefly now?
I think Commerce is here. I think we could get where are we at with MSHA. I know that you issued that letter talking about what it would, how the process would look.
Mr. Chairman, again, Peter Brickwitty from the Commerce Department, and Senator, we can have a much more detailed conversation. But in the interest of time, the Commerce Department is, as you know, or was charged legislatively to plan for the eventual appropriate termination of the MNsure program. We are in the process of working through the development of the transition plan. The department has on its website, and you have all received an electronic version of this, as well as your staff, the draft transition plan, which is posted online for public comment. We have been doing a second round of public input sessions, the next one of which starts in about 90 minutes. Video conference, I have to say, a tip of the hat to our counterparts at DHS, who have allowed us to utilize their video conferencing system, which has allowed us to really amplify our outreach to folks, particularly in greater Minnesota. And we've been working to develop the transition plan, and the final transition plan will be issued a little bit later this fall. I suspect that will be of interest to members, and I'm happy to follow up with any specific questions you might have as we either today or as we go along forward to that final transition plan issuance.
Thank you, Mr. Brickwitty and Mr. Chair. I know we haven't gotten to future agenda items, but I would like a little more walkthrough on MSHA and how we're covering the gaps of what's covered with MSHA and what's not in a basic health plan in the essential benefits set. So if we could add that as a future agenda item, I'll try to remind.
We'll take note of that. I think that'd be a good.
And Mr. Chair, I would add that MNsure has graciously had staff at virtually all of the public meetings because I would say probably 90% of the questions that we receive during the public comment sessions are MNsure related at these MSHA sessions. There's a lot of, that's sort of a mouthful. So it's been a good collaboration and another opportunity to do more outreach to Minnesotans about the changes that are coming in 2014.
Okay. Any other general questions of members? Seeing none, we'll get Commissioner Parnell to, or maybe not, Commissioner Parnell.
Sure. Mr. Chair and members, for the record, my name is Jesse Oman. I'm the Assistant Commissioner around projects and initiatives for Minute Services. And I will work to be brief, as I know we're trying to catch up a little bit on our schedule here. We've already had a great project update and I think an oversight there. What I wanted to touch on briefly is the partnership that Minute has had with this project and this effort in general. This project has really been a strong joint effort among not only Minute, which has brought 4 of its CIOs across different agencies and a number of different Minute staff, from full-time to being able to touch on in different areas, to particularly strong business partners that have been heavily engaged, knowledgeable, and have been willing to work side by side with the Minute staff as we move forward into our COTS vendors, which has been touched on earlier, that are part of this solution, working with both those entities. That partnership, that together jointness, is what's allowed this project to be able to progress and move forward even with the tight timeline. As it transitions forward outside of the project perspective and more into going live and ongoing support, you'll see that relationship, those services that are provided from Minute, being managed and outlined within an SLA. The SLA development and the SLA as a whole is something that's used with all agencies. It really allows that partnership on both sides to be able to define what is being expected, what services are being provided, what metrics are going to be recorded in there, and just adds a little bit more of a common understanding around what services we have offered and how they'll be provided. That agreement is not in place yet because we are still within project mode, but that's something that would be drafted as we look to move forward and go live with this application. In parallel to the MNsure project, there is within Minute both a consolidation and a 2-year tactical plan. Part of that plan really details out building a base set of functionality and services based on industry best practices and performance that's out there to be able to provide not only for MNsure, but whatever agencies and applications going forward, a common platform, a delivery mechanism, and a way to be able to deliver this in a cost-effective manner. So that is going on in parallel, and as we look to move forward, you can see that is one of the base foundations that MNsure is using, as well as other applications and projects going forward. On top of those cloud services, you have, and Ms. Malmlov touched on this quite a bit, that service orientation that has an openness and has a flexibility in a number of components. On top of that, you really see that solution components. This is not only just for MNsure going forward, but for other projects and areas that could potentially leverage this, including a lot of the modernization that's going to be occurring among the DHS and the back and forth communication that needs to occur among a lot of those applications that exist today. Mr. Chair, members, any questions? Otherwise, as promised, very brief.
No, it was brief. Any questions on the IT aspects? Okay, well, thank you very much. So, you know, as mentioned earlier, the next item on the agenda, unless folks have more questions of maybe commerce or anything, would be topics for future Oversight Committee hearings and calendar. I mean, I know that Representative Poppy suggested an active committee. I think that Senator Sharon's points went to the same desires. I see Senator Benson and Senator Nee now shaking their head. I think that we have a large task ahead of us, and so we will work to make sure that we have sufficient hearings and sufficient time to cover the work of MNsure. Other than MCHA, are there other items that committee members feel we need to make sure that we have time in the next hearing?
I thought that I had written this down, and then you mentioned also, Senator Laurie, that you would thought that we should have a hearing before the rules for the exchange for the products that will be implemented in 2015, that those are to be prepared by February 1st in order to allow for those products, and that would be another topic that I think would be helpful besides MCHA for the next meeting. Let's see, I wrote some other things down here.
I don't think for the next meeting.
Or for a future meeting.
Yeah, for future meetings, certainly, as we approach the time when those rules are beginning to take shape, I'm certain we'll have many conversations about how those will look.
I'd like to also review the grants that are being distributed for.
Yeah, August 23rd, they're going to have that first round of the $4 million infrastructure and outreach grants.
And, excuse me, may I just follow up one more? I've got cobwebs too as well, but in terms of the decisions that will be made about what is in a product, what coverage is in a product that's sold on the exchange or just in general, how is that process moving forward? We have this conversation about essential benefits or generally what it is that we believe needs to be in the product that is available. And I'm getting a lot of questions about that, and from just traditional kinds of Western medicine folks as well as the alternative systems of health care. So I just need to have a little review about what it is that's being and how we are determining what's in these products.
Okay, well, I mean, we have an essential health benefit set that's been determined. It's the largest small group plan offered in the state. It's the Health Partners Plan. We defaulted to that. We can maybe have some conversations around exactly how it looks, but then designing around that is a carrier option to make sure that that's a minimum, and those would be reviewed by Commerce to make sure that they're meeting state and federal law, and then also this leads right into the selection power that we might see additional criteria developed by MNsure. We'll make sure that we have a great deal of oversight on that as we approach the February timeline. But if members wanted to dive into the essential health benefit a little bit, there's not a lot of work going on around it at the board level or at the MNsure level right now, because it is just an entity that the carriers are trying to build their products around, and so there's a good deal of work at that level, making sure that they're complying. Is my understanding. I mean, but we can try to gain some additional clarity at a future meeting.
Seek further information for myself on this. For now,
Representative Huntley.
Well, Mr. Chair and members, just to remember that if we add a benefit that's not required by the feds, that we pay 100%.
Right.
The feds pay nothing.
Representative Loeffler.
Well, thank you, Mr. Chair. On that point, I think we have a chance in the future, it might be in 2016, to revisit that, but until then, we're kind of locked into the current provision. I was a little confused about the time frame for setting the plan selection criteria for 2015, because in our packet, there's a upcoming board decisions handout from MNsure that says February 1st, 2014 is the date by which they have to have it scheduled, but it says established process for plan selection for 2015 would recommend this be established much sooner in the fall of 2013. And so if the thought is to try and move it up in the board's discussion, then I think we need to be in tandem with whatever is evolving. But I was surprised to see that was, I mean, I'm sure the industry would love as much lead time as they can get. And one issue I've raised with others, and I'm trying to get some information, is just how we are handling the transition of people who will no longer be eligible for Minnesota Care, the over 200% of poverty group, who I'm not sure are going to find the right package for themselves in the exchange in the first year, but will be able to be picked up in the second year with maybe the expanded, action on the basic health plan. So I just really would like to know a little bit more about what the notices are and some of that kind of input to that group, because that's a group that has stepped forward, and we'd love to keep them insured if we can.
So maybe some a little deeper dive into the population between 200 and 275% of federal poverty level,
and whether or not the navigators are expected to do any special efforts in reaching out to that group, that sort of thing.
I mean, maybe we could get MNsure staff to actually provide us something between now and the next meeting regarding that that subset.
Yeah, I mean, I just don't know when they're going to get the notice that things are changing and that they need to step up, and
Right.
I just want to catch as many as we can.
I think didn't we ask in statute for DHS to be pursuing options with the feds for that population? Maybe we could find out what's happening with that, if there's any action around that. That'd be a good topic. Senator Benson, Senator Nino.
Well, I just, when we were talking about the grants in the testimony, if I recall correctly, it sounded like the grant proposal was going to be presented to the board August 7th, assuming that it gets approved sometime after August 7th. We wouldn't have to wait till August 23rd necessarily to start reviewing that. I prefer earlier than later, but it's obviously up to he who has the gavel. But that just FYI.
Okay. So,
Can I ask a question?
okay, I didn't catch the August 7th presentation of the board. That was in the timeline on the...
It was oral. I don't think it was
Okay.
written.
Okay. Senator Hayden?
Well, thank you, Mr. Chair. I was just, I can appreciate the Oversight Committee and us reviewing the work that the board and that the staff has done. I was just trying to figure out to what level of detail does this Oversight Committee want to get in, and what level of micromanagement of the process do we want to be. I mean, I understand that we're looking and we want to know, and the information is important, especially as we start to roll towards our legislative session if we feel like there's things that need to be changed. But I am just a tad bit confused about how much do we want to look at. I mean, how much do we want to formally sit down and say, you gave your grant out to XYZ nonprofit organization, and this is what they're supposed to do, and now that award is out, what other than knowing that that's what they've done, and maybe make some comments. I know I'm very interested and have had some meetings with the staff about their process. I'm just trying to figure out for this body, Mr. Chair, if that process has already gone out, other than knowing who it is and making a mental note to change the process or to influence the process the next time that they have out, if we feel like the distribution was too urban or too rural, or not enough for people who lack insurance. I mean, other than understanding that, I'm trying to figure out what else would we do in a forum like this.
I mean, I was looking at my calendar and thinking, August 7th, I don't think we're going to be getting together before August 7th again. But
Yeah.
Senator Nino?
Mr. Chair, just for clarity with my comments, and maybe I misunderstood what others were talking about with grants, but the grant I was talking about was a federal grant. Along with that had to be the proposal for self-sufficiency. Presumably along with that would be the budget and staffing, which went to Representative Hoppy's points, which I was going to make as well, but he beat me to it.
But,
okay.
Senator Lori, and I do have an interest in the grant distribution that Senator Hayden's talking about. So I want to speak directly to his question, which is about why would I want to know that, and what's my interest in that in relationship to my role on the board. And it is not to try to micromanage or get involved in, but it will give me an indication of whether or not we've been clear enough in our language in the legislation, and what the process is for the decision making if we've been and need to have further clarification legislatively.
Yep. Senator Benson.
Thank you, Mr. Chair. I don't know if you have on your agenda items list, Representative Hoppy requested a budget and an organizational chart. And so at some point, a meeting where that presentation is made, I think would be tremendously helpful. And it appears in at least one case that there might have been a board member appointed with a conflict of interest, not meeting the one-year timeline. And so if we could have some discussion. There was a lot of conversation during the legislative session. You were in the center of it. You know, nobody that is actively engaged in the healthcare system, nobody who's been actively engaged in the past year. And in reviewing some of the board members, I think there's a question of some conflict of interest, and I'd like that cleared up. And so I can have our Senate Republican staff give some supporting documentation to the committee, and then have people answer to to clear that up. Let's get that out of the way. But I would defer to you, Mr. Chair, because you do chair, or to you, Senator Sharon, Policy Committee, where confirmations will go through if we want to deal with those in that
I think the
place.
confirmations are going to go through Commerce,
Okay.
actually.
Okay.
But in the Senate, I don't know the House, what they're going to do. But we'll certainly take a good look and take seriously any issues around conflicts,
Okay, then, Mr. Chair, I will take it upon myself to get something out for the other members of the committee, and we can determine if there needs to be further investigation into the conflict.
Absolutely.
Okay, thank you.
Okay. Well, I think we have quite a list of additional items to discuss at the next hearing, and I see a great deal of interest around the table from the members. Any that we missed? Any issues that we need to cover at the next hearing? If they come up, stay in touch with Stacy and Chris, the staff, and with Joe and I, and we'll make sure that the next agenda is full, and maybe we'll set a little bit more than 2 hours aside. That's unusual for a group of legislators to stay focused for this long, but it's very welcome. Myself included.
Did you set a tentative date, or are you going to?
We have not set a tentative date. Joe and I will get together and compare calendars and make sure that we can have the right staff here. I mean, I think it's tough to set a date in public like this. With that, we'll go to public testimony. There was a sign-up sheet in the back. We have two testifiers, Catherine Commit and Sarah Greenfield. Catherine, welcome to the committee. State your name for the record.
Thank you, Mr. Chairman and members. Given the late hour and the remarks that I wanted to make, and given what I just heard you talk about for your future agenda items, I think the testimony would be better used at your next meeting. So if that's okay with you, I can just delay and do that.
And we will try very hard to make sure that we have a open, accountable, transparent process, and we will leave time and take the time to have public testimony at the end of each of them. That's something that's very important. Ms. Greenfield? Welcome to the committee.
Thank you. Hello, Chair, committee members. I'll be very brief. My name is Sarah Greenfield. I'm the Healthcare Program Manager at Take Action Minnesota. We've worked with many of you over the past couple years to try and implement the Affordable Care Act here in Minnesota and make sure to do it in a way that puts people at the center. I want to say we're really glad to see the Consumer Assistance Partners program in particular moving forward on time, on track. This is a program that I think will be very important to successful enrollment in MNsure. The people are going to turn to organizations that they know and trust. They already are, asking them questions, asking for assistance. And this program is what allows those organizations to be consistently trained, well prepared, and resourced to meet that need. And we really share the intention that, and interest in the intention that MNsure has stated in making sure that those resources go to organizations that can reach the diversity of Minnesotans who are lacking insurance or lacking insurance that they can use. So I'm really grateful to see the amount of work that MNsure staff and board have been putting in to try and get that program and all of MNsure, all the IT, off the ground on time. We know it's a lot of work and not enough staff to do it right now. The one concern I did want to raise is that we've become aware, as I think many of you have, that one of the big benefits of the Affordable Care Act to consumers can come through increased competition and the transparency of rates. And in Minnesota, the fact that rates are not visible to the board, much less to consumers, until the actual day that they go into effect, we believe makes it harder for consumers to plan and reduces the amount of interest and competition that there could be between companies, as we've seen happen in other states. So we hope that there's a resolution available to that coming soon. We'd support that. And again, just a lot of gratitude to everyone for the work.
Thank you. All right. Well, that's all the public testimony that signed up. Was there anyone else in the public who wished to offer insights? Seeing none, we'll stand adjourned.